Hi, I'm David Gottenborg, and I thought a good subject today would be on pain. And so what I'm going to try to do is focus in on the type of pain that's associated with people that may have a meniscus tear, arthritic type pain in the lower back, or in some instances, what happens when you tear the fibers of the disc. Some doctors call this a herniation. One of the most common questions we hear from patients is, why are my joints aging prematurely? Or why am I more prone to a disc injury or an injury to the meniscus of my knee? And really it's not that complicated. And I have a little example here. This basically shows a healthy lumbar disc. And this shows a disc that has begun to thin. Its width is changing. And really what happens to the disc as we age, or the cartilage in our knee, is that they become more cork-like. Cartilage is without blood, so as we age, the disc becomes more cork-like. Therefore, it's prone to either collapsing or, in some cases, tearing or fracturing. So getting back to the subject title, pain, what we're finding, or what I'm finding is happening more often is of course, people want to be without pain, and medically it seems as though something that's increasing is more prevalent is steroid injections. And so people are getting steroid injections in their knee or in their low back. And while there is reasons for this, I can tell you some good reasons why you might want to consider it, is number one, once you introduce a steroid into the joint, it stops the inflammatory process. That's an important process for long-term healing. The injection does nothing to repair or restore healthy tissue. It just stops inflammation. And perhaps the last thing is cortisone is caustic. It leaves some residuals. My approach, and I think most chiropractors' approach to helping someone with one of these problems is to improve function. And we do that by either supporting a person's posture from the foot upward. This may include wearing orthotics, and definitely by improving alignment and motion in the joint that we're concerned about. And the last thing we do is there are good things out there that we can use to actually feed the joint or feed the cartilage so that it repairs quicker and lasts longer. What I've done here is I've pulled out a disc from one of the models, and this displays what can happen to a disc. It's called an annular tear. The disc fractures. So what can we do nutritionally? Well, number one, a good supplement that probably a lot of people heard of is glucosamine. And what glucosamine does simply is it attracts water. So it keeps the disc or the meniscus in the knee flexible, pliable. The second supplement we'll often use is supplements that are rich in vitamin A and C, because that supports collagen and rebuilds tissue. And the last one, which is very, very important, is those trace minerals, especially things like manganese, zinc, and copper. And those are important for building integrity and tensile strength into connective tissue. And the only other thing we tell people, you have to be patient. You can inject a torn meniscus with a steroid, and while you may feel better, it's not going to help that tissue repair. Treating it nutritionally will take time, sometimes 4 to 6 months, but you'll feel a lot better in the end. In closing, if you have any questions about this, our information will follow, and we're open to helping really anyone achieve whatever type of health they want. Thank you.
Thank you for watching Wellness for Life.